Hey, Dr. Dave here. I am here today with Isaiah. He was kind enough to allow us to talk about his case and shoot a video. He's here from Uruguay. He's here visiting some family. You may have seen a previous video with his sister. He and his sister are here visiting family. And they're both here to get spinal checkups. So Isaiah, back in 2005, he was around age 5, had an incident where he was playing and fell off a bunk bed and fell backwards. Fell backwards, correct? Mm-hmm. Fell backwards and had a head trauma, had a head injury where he had and correct me if I'm saying anything wrong, right? He hit his head, there's trauma to the back and front of his brain, but he had a brain bleed intercranial, inside the cranium in the back portion of his brain. His mom said that afterwards he did have a seizure. He stopped breathing for a period of time, and he actually too, when she looked at his eyes, one went this way and one went that way. So he definitely had a brain trauma, and I'm glad he's here today. I mean, that's really good that he recovered from that. But we're going to look and explore at age 5, he's now age 16, what kind of a trauma like that does to the body and what kind of things are showing up in his body now. So symptomatically, he primarily came in with a lot of lower back pain that he's been experiencing for a couple months?
Couple years.
A couple years. And it was intense back a couple months ago. Mm-hmm. And so he's been experiencing lower back pain. And he just has a general, I'm going to say, discomfort that he feels like he just has to relieve. And he tries to move because it's, I guess, uncomfortable.
Yeah.
Right? I don't want to put words in his mouth, but and so we're going to explain why that is. So we did some scans on him, all right? And the scans are looking at stress and tension in the nervous system and in the muscular system, all right? And so let me explain this first too. So the spine is our lifeline. This spine controls and coordinates our entire life. Messages get sent from the brain, down the spinal cord, and out these nerves to all of our body parts. So it's important for us to have good communication between the brain and body. Now life happens. To say in his case, he fell back, had a head trauma, and it created misalignments to his neck, but it also created other misalignments to his spine. When the spine misaligns, certain things get stuck. And these spine segments don't move properly, which will create a local problem. It'll affect mobility. It will cause muscles to become imbalanced. Some are pulling harder, some are weaker. It creates a muscle imbalance, which could create a pulling to the spine. The ligaments in the spine sprain, and they don't support the spine anymore. So you can get instability. So you get lack of mobility, instability. It can cause stress to the nerves, and then eventually cause damage to the bones and cartilage known as arthritis. So we refer to that as a subluxation. Word means less than a dislocation. The spine's not dislocated, but it's out of alignment enough where it's creating stress and tension on the body and affecting overall health. Not just pain, it affects health. So these scans were looking at the stress and tension in his body from a subluxation or trauma, and his first one was stress and tension on the nerves coming out of the spine. The colors indicate how much. So green is mild, blue is moderate, red is severe, nerve stress, nerve pressure. So that's a lot of stress and tension within his nervous system. Basically, his body is in distress, his nervous system can't relax, and it's causing him to have to try and move to try and create some comfort. In the muscle system, this is a normal muscle scan, symmetrical, white in color, pear-shaped is a normal scan, and this is his. This is tension in his muscles. Again, a lot in his neck, mid-back, and really lit up red in his lower back where his primary symptoms or pain are right now. And an imbalance in his muscles. His left side's pulling harder, then it shifts to the right, then back to the left, then right, left. There's like this tug-of-war going on in his spine, so it creates tension and stress on the bones, joints, nerves, ligaments, tendons, etc. So basically his body is out of balance. It's in a state of stress or distress, and our goal is to get that stress and tension out of his body and his nerve system so his body heals, his brain heals, his nerves heal, and his body relaxes so he expresses better health as a result of it. So, does that make sense?
Yeah.
Now, you're going to explain and say everything I said back to them.
Right.
Just say everything he said.
Just to see how much you're paying attention. We're going to see if you can mimic that.
Okay.
All right, so that's how his body's performing, what kind of stress is in it. Behind me are his x-rays. And that's almost, hello. Who put that there? So we're looking at him on this one as if he's facing the wall and we're looking at him from behind. So his left and right hip are uneven. His left hip is 5 millimeters, 6 millimeters higher than the right. He's got a pelvic tilt. So the pelvis tilts this way, and it's causing his spine to tilt to the right too. It's tilting all the way to the right till about his right shoulder blade, just below his right shoulder blade, and then it tilts to the left, and it's going to the left fairly all the way up, and then his upper spine's tilting that way. His left shoulder looks like it's higher than his right shoulder. His left hip is higher than his right hip. So he's out of alignment. He's out of balance, and his head's like kind of tilted this way. He's got a lot of pressure in his upper neck. These lines should be parallel to the horizon. They should be parallel to the ground. You can see these spread out over here, closed down here. He's got a lot of stress and pressure in his upper neck, probably from the head injury is what I'm going to guess, when he fell backwards. So I'm going to be working on his upper neck and on his pelvis. Now the temptation is, because he's got a lot of pressure here, I might leave his mid-back alone until next visit. I'll see what I feel when he gets, when I evaluate him in a chair. By the way, this is your first adjustment ever, right?
Mm-hmm.
And this is my first time ever adjusting him. So I have to get familiar with his body. We're going to, communicate, interact. Got to get used to his body tone. So neck should arc to the front. Actually, it should arc this way. This is a normal neck curve. His is going the complete opposite direction. Mid-back, it should arc this way. His is completely straight. Lower back should arc this way. He does have a little bit of curve. It's a little bit reduced in here. So he has curves where he shouldn't have them. And here he has curves in the opposite direction of what they should be normal. In addition, at 16, he's got some arthritic spurs forming already. And we usually say arthritis is an older person condition, but it's not. It's really as a product of trauma or misalignment, and it starts to wear away some of the cartilage or creates trauma to the bone. So he's got some arthritic spurring already in his mid-neck at 16. So this is going a complete opposite direction. He's got a lot of pressure up here. He doesn't have any curve in here. So these shock absorbers are not there. His body can't absorb stress of everyday life, and it's just transmitting stress. And then he has less than a curve here. It looks like he has a healed compression fracture here. He's got just a lot of evidence of previous traumas. So we're going to work on this to take the stress off his nervous system, try and take the stress off these curves, try and restore curves over time, and just get his body healing better. Make sense?
Yes or yes?
Yes or yes? I mean, there's other technicalities in there, but I don't want to turn people into a radiologist. I want you to just get the gist that spine problems are health problems. Alignment problems are health problems because they affect the body in general, not just cause pain. So we're going to transition into your first adjustment ever. Are you excited? Are you
Yeah.
excited, scared, or both?
I'm excited. honestly.
Good, I want you to be excited. You're going to sit in this chair and face that way.
Okay.
All right? When you come in, I run this instrument down your spine. It's called a nervoscope. It helps me find where I'm going to be adjusting you.
Okay.
It reads heat patterns from right to left, and if there's a difference between right to left, this scope is going to pick it up, and it just gives me a little more specificity as to where I'm adjusting him.
Can you say that 6 times fast? Specificity.
So as I bring this up, he's pinned to the right. He's got a lot of pressure in his upper neck, as you saw in his x-ray, and he's just got a lot of pressure up here. Now he's got a few in his mid-back too from the other night that I'm aware of. I'm gonna lift this up, Isaiah. And that's a pretty strong scope reading right there. So we're gonna mark that, come back to it. He's got a lot of activity. As you go down here, you'll start to see the needle move. Now he has a other condition that I didn't point out on the x-ray called a spondylolisthesis at L5. That's when a bone moves forward in relation to the one above and below it. So I'm getting a reading at L5, but we don't adjust the spondylolisthesis because we're pushing forward and the segment's already forward, so you don't want to be adjusting that. You want to be aware of it and be adjusting below it. But I'm finding a right pelvic problem in him. And that's from last night's evaluation. So this is just feeling, make sure I feel the mobility of the spine, feeling for muscle spasm, tension, swelling, lack of mobility, which I feel in his upper right neck, where that big gap is on the right side. And right lower back. So I'm going to do this different than I did Julia. We started there. I'm going to start over here actually in his pelvis, lower back. And then we're going to come back to this table, to this chair. So we're going to come here first, Isaiah. And what you're going to do
Let me go to the other end, sorry.
Actually, I'm also going to have you take your shoes off. Because I'm going to work on your feet and knees. He also has flat feet, so we're going to work on his feet. Found some misalignment, subluxations of his feet, knees. Give him a whole initial tune-up. So I'm going to have you lay on your side, face me. Your shoulder's going to go here, and your head is going to go here. I'm going to bend this top leg, keep the bottom one straight.
Yeah, well,
I'm going to have you hug yourself.
sorry for the rolling around here, everybody. I just want to get a good view.
Now he's a thin, flexible guy, so I'm going to have to find the tension in his spine to adjust his pelvis. So I'm going to be stretching him out. I'm going to be stretching you out kind of like a rubber band. It's going to feel like I'm laying on you, so don't punch me or kick me, all right? And you're going to hear a popping or cracking noise. That's not bones breaking or cracking. It's just air released from the spine, all right? So get on this guy. Adjusting his right ilium. I'm going to roll him towards me a little bit. Isaiah, you're going to feel me stretch out like a rubber band and then push. One more. I'm going to have you sit up, push yourself up with this elbow, sit up and face me. Good. We're going to actually go back to this chair. I'm going to feel how this is moving. Because it did move. It actually started to move before I even pushed hard, but doing all right so far?
Mm-hmm.
Okay. I'm just going to stretch these shoulders out a little bit. I'm going to feel a tension in your shoulders. Okay. And adjust his upper right neck next. I'm going to have you lean back in this chair. I'm going to put this little
Sorry,
seatbelt
sorry.
around you.
Yeah.
Strapping you into the roller coaster.
This is so you don't run away. No. I'm going to be pushing from back to front, so I want to keep you in a chair. This is going to be adjusting your right upper neck right behind your ear, all right? So the noise might be a little louder because it's right by your ear. We're going to bring your head to the right. And then I'm going to be pushing sideways this way. Good job. Now he has a nice, long, flexible neck, so those could be challenging to adjust, but he did well. I'm going to actually bring you to this table. This table, you're going to face down, face where the paper is, hands over here. You doing all right so far?
Yep.
Anything that hurts, bothers you, that feels, just let me know, all right?
Yep.
Even though we're on video, you can talk to me and let me know things. It's okay. This is T11. I think I'm going to work on T11 a little bit. So what you're going to feel me do, Isaiah, you're going to feel me lean into you, and then I'm going to be pushing this way. Good job. I'm going to check your knees next. I have this little board I'm going to put under your knee. You're going to feel it, I'm going to push down, and you're going to feel it drop like that, okay? It shouldn't hurt, but if it's uncomfortable, let me know.
Okay.
You're going to feel me just push down. Doing all right? Good. Now, his feet should be like this, but they're coming in this way. And it's creating a rotation of his knees and even up into his lower back and hips. So part of adjusting these over time is going to be taking the foot flare out of this.
I just wanted to get a view of it for you.
We're trying to take some of that foot flare out of it. There's a lot of tension on these Achilles tendons. I'm going to bring him up, and then we're going to turn him around. Like a rotisserie. So you're going to just turn around on this table. And then we're going to go backwards.
All right.
Isn't this exciting?
Oh, yeah.
He feels better already.
He's like, why did my grandmother send me here? And why did I listen?
My daughter's 23, Isaiah. She's been getting adjusted since she was 8. And I brought her in here because she had seizures.
Oh.
I took her off all her meds. She hasn't had a seizure in however many years that is. You do the math. It's just a long time. This was previous to me working here, just so your listeners know.
I'm not going to pull you off the table, Isaiah. So there's a lot of tension in his feet, especially the left navicular, but it adjusted well. I'll just keep working on it. Again, this is his first adjustment ever. I don't want to do too much to his body, overload it. We're going to go back to that chair.
Normally this table's not in the way. I just had it down for the video.
I already feel less tension in his neck. He might not necessarily feel it yet, but I feel it.
Do you feel any difference, Isaiah?
Yeah, actually, a lot of difference.
What's different?
Everything that I felt in my back is gone at the moment.
That's interesting.
I don't know.
From a pain perspective, you mean? Any of the
Just
pain
like
you were feeling?
uncomfortable, yeah.
Yeah,
I
good.
don't-
Blood flowing.
Life flowing
Yeah,
to these body parts.
yeah. He's a knuckle cracker, aren't you?
Took all my fun away.